So this has been a journey of about 2 or 3 years already, so it's a little different to some of the other vanguards that you may have been involved in. A lot of the thinking, the national development work, the evidence accrual has already been done. That was done through the first and second years. What we did, having then all agreed the principles and the objectives by which any new system should deliver, we then developed over the last 12 months a set of products based on what you and thousands of clinicians, patients and managers have told us in the system are needed, and they are to help people move along. Those bits are relatively straightforward. It's the implementation that is really difficult. How do you turn those into something that really works for your local health economy, for your patients, for your bit of the NHS? And that's really where we are with the vanguards for the urgent emergency care. It's about taking what we've done so far with all of you and then saying, right, how do we actually really invent this at the local level and develop it and then share it very quickly? One thing I'd say is, if you are successful in becoming an urgent emergency care vanguard site, you won't be doing this on your own. The whole country is moving forward. You will be the spearheads, and the responsibility for you as vanguards will be to rapidly share, as Sam has said, that learning, get those barriers out of the way, helping us to do that, so that everybody else can move forward. And actually, you see, the exercise of applying to become a vanguard has probably done a lot of good in terms of getting you together and focusing locally. So this will be a launch pad for you, whether you are successful or not. The principles of the Urgent Emergency Care Review are very clear. Providing highly responsive local care as close to home or in a patient's home as is possible. And that's the vast majority. But for that very small number of patients who will benefit, who have life-threatening or life-changing events going on, they need to get to specialist care very promptly. There's a whole list of things in the review that were the objectives, and those are some of them. I'm not going to go through them. But what we want is, I can see that happening just about everywhere across the country. But what I want to see from the vanguards are really innovative ways of making it happen at pace, effectively, and in a coordinated way. Whether you're talking about patient self-care, whether you're talking about the smart 111 call and booking into services, whether you're talking about a composite clinical advice hub that supports both patients and clinicians, whether you're talking about the way you organise your front end of your hospital. So we're talking about networks in a way we've never talked about before. You'll be aware of things like cancer networks, where you're drawing patients into a specialist centre. The networks we want to see in urgent emergency care have the opposite flow. That the specialists in the specialist hospitals will support those consultants in the local hospital where that specialty is not present. Those consultants, general practitioners, paramedics, pharmacists, will all support the community. So whether you're a GP in your surgery, whether you're a paramedic at the scene, whether you're a community nurse in the house, whoever you are, if but for the want of a bit more expertise, seniority or information, I could make a better decision about the patient where they are now and not move them on to a higher acuity setting, which is usually unhelpful for the patient, inconvenient and expensive. That's what we're all about. So we're saying no consult should occur in isolation. That's what I mean by network. At the local health economy level, you have the system resilience groups with all the parties represented. And so many of you will be coming, telling us how you're going to do that at that level. But also the networks have to be bigger than that, because there are many things that are beyond the scope of one SRG, accessing specialist services, ambulance protocols, those sorts of things. So we also want to be testing out how we make those bigger networks work, how you build those clinically and operationally, and then how we can lay over that a collegiate commissioning structure that really facilitates that to happen. So SRGs, CCGs, NHS England, the arm's length bodies are all steering in the right direction for an economy. What will you need to do then? You're going to need to engage really quite intensively with us, and you're going to help us co-design and mature the products that we've already got so other people can learn from you. Nationally, I need you to test out some of the stuff so that we can go back and refine it, and also for you to identify the barriers that we can take down nationally. So that's quite a big commitment from you. So I hope you're not here on a whim, because if you're successful, you might regret it. Sharing data, you can't be precious about this. This is the national bit of the National Health Service. So everybody's got to learn from you. Thank you very much.
My task is not to fall off the stage at some point today. So just to put some context around it, you absolutely, as Keith has said, are designing the future NHS today real time. And if you talk to any one of the 29 vanguards, it feels like a lot is happening. There's a huge amount of expectation and they are raring to go. The one bit of it is the non-negotiable, is the national replicability part of it. So to get to this point, we started about 3.5 weeks ago, 4 weeks ago, I think it was. And we had closing date of the 15th at 9 o'clock. Thank you very much. There's a huge amount of seminars, webinars, all of those kind of things happening over the last few weeks. There's been shortlisting taking place yesterday. Thank you so much to everybody that was involved over 24 hours. I've discovered a whole new part of the day and night that's not related to my 6-year-old twins. 17th of July, today, we're doing it today. By the end of today, you will be asked to vote. You'll be asked to vote to put forward your top 3, and we will be collating the responses this evening for a recommendation to the 7 Chief Executive Board that meets on Monday. So it's real time, it's happening real time, and by the end of today, we'll be coming out with our recommendations, and you're shaping it and you're part of it.